want to talk a little bit about barriers to access. So, what do you guys see as some of the barriers to access in the minority? Like, what are some of the things in your communities that keep people? And I know, first of all, let's just say you are not speaking on behalf of all people of color everywhere and every minority everywhere. So, if you could just speak to your own experiences as to what you think are the barriers that really
Okay.
keep people from accessing the services that they might need, either some internal barriers or external barriers.
Well, I guess I can actually personally speak on it for sure.
For sure.
Well, the biggest barrier that I see, even with myself and a majority of the minority community, is that we face lower insurance coverage and high costs
Oh my
that
God.
may. Thought I turned this thing on. I'm sorry. Let me
That's all right.
turn
You're
off.
reminding me to turn my stuff
I
off
know.
too.
Alexa, silence mic, please. Alexa, turn mic off. And somebody's in my yard and at my door. I can see them, but I'm not gonna. Anyway, and for like I say, for me and most of the community and the people that is around me that is of color, we have experienced really have faced with low insurance coverage or high costs that has made treatment unaffordable and diagnosis underdiagnosed and it has led to mistrust and not getting the services that we need. So those barriers are huge and it's still ongoing. And it's just been lifelong problems that we have just dealt with for many years. And so right now, even with the healthcare systems that insurance companies that we not able to find that someone that will even support us that's in network, all of that is our barriers that has really plagued us, especially now.
What about you, Annette? What do you think?
So low barrier to access is where I live. It's one of the founding tenets of what we do is I try to always have low barrier to access. A real-time example I can give you is with the peer support program and the training that is being offered. It has been my experience that participants that come to me, if they're employed, right, an employer, if the participant is white, will get the job and be told they'll have 6 months to get the training. Person of color will be told you can have the job, but you need the training first. So get the training and you can get the job. So then when these two participants now go to the healthcare authority and are trying to get the training, there's a ranking system, right? And so you're number one if you have a job and you need this job for training, you need this training to keep your job. Number
Yeah.
two, you have a job possibility, three, etc. So people of color are never number one. So they can't get the training that they need to get the job, while white people are getting the job and the training that they need. So where we sit as an organization is we very deliberately ask for those lower ranking numbers and bring them into community. Because when we first started doing this training, quite honestly, it was all white people that were participants in the training. When we started asking for those different numbers, we started seeing people that looked like us. And it was
Wow.
amazing. And we continue to do that. And it wasn't just people of color, it was also men. There were no, I was lucky to have one man in my training. I'm very proud to say that in my last training, I actually counted and it was 50-50.
Oh,
So
Nice.
that it was
yes.
50-50 and that was great. And so we have a lot of work to do to represent gender in general and all of that, but it's definitely, we're headed in the right direction. So, and making a difference, but that's the best example I have. And then probably personally judgment. There have
Mm.
been experiences I've had going in and receiving services, whether it's medical or otherwise, where I'm treated like I don't know myself, have a clue, and I don't have the education and I don't have the knowledge, and that I go in and I'm very treated much like this, and to my detriment. I'm the only one that's going to suffer when that practitioner gets it wrong. So, and that for me results in me not seeking the typical type of services. I'm always looking for outside the box support and services, hashtag peer support, which I don't hashtag all that stuff. But anyway, if I did, I think it would go there.